Hello, welcome to your 2020 open enrollment for Adonel Concrete. This is our open annual enrollment and we will be reviewing all your benefit options. I recommend everyone to hold on to your book throughout the years as it is very informative information within the text that you might find yourself returning back to get additional information. So again, hold on to your book. We will be reviewing through the book and answering any questions you might have. Your first page is your content page with all your information within the book. Your directory is very important within Sapoznik Insurance. Please note that you do have a go-to account manager by the name of Robin Konikoff to go to for any questions, any problems, anything regarding your benefits. Who is eligible? All full-time employees that work 30 hours or more, and your covered dependents are your child and spouse, your children up to the age of 26 in the state of Florida. Please understand that once you make your selections for your coming year, you cannot make changes mid-year. This is a federal law. Unless, however, there are certain qualifying events that the IRS has approved where you will be able to make some changes onto your plan. For instance, a marriage, a divorce, a legal separation, or the birth or adoption of a child, a change in your child's dependent status. For instance, let's say that your child is currently under some type of kid care program or Medicaid program, and God forbid they lose those benefits, then that would be a qualifying event to come on board onto your plan if you wish to do so. So there are certain qualifying events that the IRS has allowed for us to make changes mid-year. However, please understand that there is only a 30-day window to make those changes. The 30 days begin from the date of the event. So that would be from the date of the birth, from the date of the marriage, from the date of the loss of coverage. If you think you might be going through a qualifying event, please reach out to Robin within our company. She'll be able to assist you with making the changes and letting you know what documentation might be needed in order to process that change. Your next page is your benefit highlights. All your new benefits will be effective January 1st. So please make sure to complete your enrollment part of that so that you have all your pertinent information already within the system by January 1st. All new employees are eligible for the benefits the first of the month following 60 days. And the benefits that are available are medical, gap, dental, vision, voluntary life, the employee assistance program, which is totally free, and the supplemental insurance. The HIPAA enrollment notice, loss of coverage, birth and adoption is what I mentioned earlier regarding the qualifying events. Again, if you have any questions regarding that, feel free to reach out to Robin. Your first set of benefits is Humana. This would be your same benefits as last year, so your health benefits structure did not change. It is an HMO plan. That basically means it only has in-network benefits. So please make sure when receiving services, if you select this plan, that all your providers are within the network. The name of your network, we're always going to list on the top of the page, which is the HMO Premier Plan. It is in-network only. It is also open access. That's what that OA stands for, open access. So what that means to you is that you don't need a referral. As long as your provider is within your network, feel free to just go ahead and make your appointment and go see that provider. There is an annual deductible on this plan of $4,000. Understand that your deductible only comes to play for certain services. For these services, which are the majority of them that have co-payments, you do not need to meet the deductible. So the deductible most of the times are never reached by the covered parties because it only applies for certain services. The annual deductible is $4,000 for the individual, $8,000 if you're a family. So that protects you as well. If you're a family of 5, then you only have to meet the deductible times 2. Your member co-insurance as a percentage of the bill that you're responsible for is 30% on this plan. Your maximum out of pocket is a very important number, a number you should always look at when shopping for insurance, since this is a number that gives you your maximum financial exposure any given year. On this plan is $6,500 for the individual if you're just covering yourself. If you're covering a family, it's $13,000 for maximum family. So what this number means to you, this number includes your $4,000 deductible gets thrown into this bucket. Your 30% co-insurance, whatever you pay on that, gets thrown into this bucket. Any co-payments, anything you use as you're using your plan gets thrown into this bucket. If you ever reach the number of $6,500 for an individual, then the plan covers you for the remainder of that year at 100%, and you no longer have any co-payments. The plans are unlimited, so regardless if your medical bills are $100,000 or $2 million, your maximum financial exposure will be $6,500. And once you reach that number, the plan will continue to cover you at 100%, and you will no longer need to make any co-payments. As far as your physician services, your physicians are your primary doctors. They would be your general practitioners, family practitioners, internists, and pediatricians. Those are a $40 copayment. Whenever you see a copayment, everything within that doctor's visit is covered within that copayment amount. Your specialists are every other type of doctor, and it is an open access plan, so you don't need to make a referral. Just make sure that the physician is in the network, since this is an HMO plan. The copayment for the physician visit is $65. Preventive care, we all get one annual preventive visit, totally covered at 100%. It is every 12 months. So if you received your last preventive visit January 10th, your next visit will be due January 11th. So it is exactly 12 months to the date for it to be covered at 100%. Everything is covered within that visit based on our age and gender. So the American Medical Association determines what is covered based on our age and gender, and everything is covered that's considered a preventive visit. Now, when you go for your preventive visit, please make sure to go healthy. Make sure to, when you go to that visit, is to build a relationship with your doctor, talk about your family history, talk about medications, but make sure that you're healthy for this visit, because if by chance you're sick or you mention to the doctor, I have a sore throat or I have an earache, or then it's no longer considered a preventive visit. It will be considered a diagnostic visit, and then you might be charged a $40 copayment. If you go healthy, please understand you will not be charged anything for that visit. It is covered at 100%, including your copayment, no copayment. Your diagnostic services, your labs, for all your lab work, you have Quest and LabCorp, so you have the two largest laboratories in the country, and all your labs are covered at 100%. Also, to give you another tip, understand that when you go for lab work, a lot of the times when the doctor wants you to get some lab work, he'll give you a prescription. Some doctors' offices will offer to draw the blood within his office, which is a convenience for you if you desire to do that. However, some doctors' offices do charge for that service, so make sure to have that question answered for you prior to getting your blood drawn, because that is not covered by the insurance, or whatever fees he charges for that service. Your MRIs, MRA, CT scan, and PET scans are covered at $300 copayment. Your emergency room and urgent care services, your emergency room is a $350 copayment versus your urgent care is a $100 copayment. So it's a big difference between the two copayments. Emergency rooms are normally in a hospital facility. Hospitals negotiate very expensive contracts with insurance companies, so any services rendered at a hospital facility is always going to be more costly to you. Your emergency rooms should really be used for life-threatening emergencies. Otherwise, you should address and go to your urgent care centers. Now, your urgent care centers are not open 24 hours, 7 days a week like your hospital emergency rooms are. So we do have to do our due diligence, look through our network, find our closest urgent care provider within our home that is open 24 hours, 7 days a week. Program that into your phone or put it by your refrigerator, so when the emergency arises, you'll know where to go, and it will only cost you $100. You also have within Humana, you have teledoc visits, which are really appointments with a doctor through your telephone or through your smartphone. And it would be the same copayment as your physician copayment of $40. And that information is listed on the back of your ID card. I recommend for you to register. And once you're registered, if you need that service, it would just be a matter of making the appointment. Now, your outpatient and inpatient services on this plan are covered after the deductible are met, and 30% responsibility. So that would be for outpatient services, meaning you go in and out the same day. Inpatient services obviously means you're admitted to the hospital. So let me give you an example for outpatient services. Let's say you need outpatient procedure. First of all, I would always ask the person in the doctor's office coordinating this procedure, since most of the time this is an elective procedure, to make sure that it is provided through an ambulatory surgical center that is not hospital affiliated. As I mentioned, anything performed at the hospital is going to be a lot more expensive for you. And since you do have to meet the deductible for this service prior to Humana covering the service, you want to really get the best available price available. So I would discuss this with the person coordinating at the doctor's office, which ambulatory surgical center the doctor is affiliated with, and schedule your procedure there. Let's say the procedure is $2,000. You will pay the initial $2,000. Whatever you pay goes against lowering your $4,000 deductible. Now for the remainder of the year, you would only have a $2,000 deductible. Okay, if you're admitted, the way that the deductible is applied, once you leave the hospital, the total bill will be sent to Humana. If the bill, let's say, is $50,000, they will reduce the first $4,000. As far as the insurance is concerned, you've already met your deductible. Even though you might not have paid for it yet, it has already been processed through your explanation of benefits. So as far as Humana and your providers are concerned, that $4,000 deductible has already been met for the remainder of the year. Same thing with your doctors at the hospital. The deductible and the coinsurance applies. For your pharmacies, please understand you must fulfill your prescriptions at a Walmart, CVS, or Target, as well as Publix or your mail-in orders. Please note, Walgreens is not a participating pharmacy with the Humana plans. So make sure when you receive your prescriptions to go to one of the participating providers. Your prescriptions are $10 for generic, $40 for brand name, $70 for non-formulary, and 25% to $35 for the injectables. Your dependent age is up to the age of 30, so your eligible dependents are eligible in the state of Florida to age 30. 26 for the remainder of the other states. And this would be your first plan being offered to you through Humana. It is the Humana HMO Premier Plan. The name of the plan is listed in red, HMO OA 16 4000. Your next benefit option is your GAP plan. You can purchase this GAP plan to help you with the deductible on that first plan that I just discussed on your HMO plan. So the GAP is through Transamerica. It is a separate company, so that if you decide to get the GAP, you will get an additional ID card through Transamerica. The benefit that goes with this plan with Humana is a $4,000 GAP for inpatient services. So the deductible on the plan is $4,000. So if you get admitted into the hospital and you have the GAP, your deductible is actually covered at 100% and you pay nothing, since the deductible is $4,000 and the GAP benefit is $4,000. In addition to that, the GAP is going to give you an additional $2,000 for outpatient services. Outpatient services are services that you're not in the hospital, and basically it's going to give you an additional $2,000. The way that it works, your outpatient services that are covered within your plans are your MRIs, MRAs, CT scan, PET scans, emergency room visits, urgent cares, and any outpatient surgery procedures for the $2,000. If you notice, your labs are not covered under the outpatient services for the GAP, nor your doctor's visits. So please understand that the services covered by the $2,000 are the ones listed. So going back to the initial example that I gave you, if you needed an ambulatory surgery and that was $2,000, because the deductible on the plan was $4,000, you would have to pay the $2,000. Well, if you have the GAP would cover that outpatient procedure, and now your actual deductible to be met for the remainder of the year would be reduced by $2,000. And for accident and ambulance, you have an additional benefit of $1,000 with the GAP. Your next set of benefit is your second HMO plan. This is also in-network only. It is also open access. The difference is that this plan has a $2,000 deductible, $4,000 maximum for the family, with a 20% coinsurance, versus the first plan had a $4,000 deductible for the individual, $8,000 for the family, and a 30% coinsurance. The maximum out of pocket, however, are the same on both plans. $6,500 for the individual, $13,000 for the family. And of course, both plans are also unlimited. The co-payments vary just a little bit between the two plans. This one is $30 to see a doctor versus $40 on the first plan, $55 for a specialist versus $65 on the first plan. Preventive covered on all your plans at 100%. Your labs covered at 100% on both plans. Your MRI, CT scans are covered the same on both plans of $300. Same thing with your emergency room, same copayment of $350. On this plan, your urgent care copayment is $75 versus $100 on the first HMO plan. All your other services, outpatient surgery and inpatient, are covered at 20% after the deductible. So it would be 20% after the $2,000 annual deductible, versus the prior plan was 30% after the $4,000 deductible. And again, your pharmacies, please make sure that your prescriptions are filled at a Walmart, CVS, Target, Publix, or by mail. Please keep in mind that Walgreens is not part of the network for your prescriptions. And the prescription coverage is the same as to your first plan. $10 for generic, $40 for brand name, $70 for non-formulary, 25% and $35 for your injectables. And the dependent age is also the same up to age 30. So the main difference between the two plans is the deductible and the coinsurance. Because the other variables are minimal amount of insignificant differences. So that is your main difference between your first HMO and your second HMO plan, although your maximum financial exposure remains the same within the two plans. Your next set of plan is your Humana PPO plan. This is a national plan. So what this means is that you have in-network and out-of-network. Anytime you have a POS plan, I highly recommend to always stay in network, especially because it's a national plan. You're going to be able to find in-network providers throughout the country. Well, the moment that you go out of network, what that means to you is that that provider does not have a contract. That means that provider can literally charge you anything that they like to charge you. It does not mean that Humana is going to process the claim based on whatever they wanted to charge you. So you're going to be left with a lot of balanced billing when you go out of network, and you want to try to avoid that. The deductible is a lot higher when you go out of network, $6,000 and $12,000 for the family, with only a 50% coinsurance. But look at your maximum financial exposure is $19,500 and $39,000, a significant amount of money. So therefore, we highly recommend with the POS plans to always stay in network, and it is what I'm going to emphasize and be going over those benefits. It is also open access, so that means no referral is required. The deductible is $2,000. This is very similar to your middle HMO plan. Same deductible, $2,000 for the individual, $4,000 for the family, with the same 20% coinsurance, same out-of-pocket amount, $6,500, $13,000. Same physician co-payment, $30 for the doctor, $55 for the specialist. Preventive always covered at 100%. Same coverage for Quest Diagnostics and LabCorp for your labs. MRI copayment is the same as your HMO mid plan. Emergency room is $150. This is a little lower versus $350 on the HMO plan. $75 for your urgent care, which is the same as your HMO mid plan. And your outpatient surgeries, inpatient admissions, and doctors within the hospital are all covered at 20% after the deductible. So that's also exactly to the mid HMO plan. Again, please note your pharmacies do not include Walgreens, so please fill your pharmacies at Walmart, CVS, Target, Publix, or mail-in order. Your prescription riders are identical as to your other three plans. $10 for generic, $40 for brand name, $70 for non-formulary. And again, the dependent age is up to age 30, the same as all your other plans. So the significant plan change within this plan is a national network. And the reason why you're going to see this is a little higher payroll deduction, it's your national network, and that you have out-of-network benefits. But as far as your in-network benefits, they're identical to your mid-HMO plan. It is, however, with the mid-HMO plan, you do have a different network, which is the HMO Premier plan. This plan is very good for people that maybe have children outside of the state and would like them to be covered. This way they can stay with the plan and still be in network. With these two plans, you can add the gap again through Transamerica. Again, if you choose the gap for either one of these two plans, please understand you will get a separate ID card through Transamerica. This gap for either one of these two plans is a $2,000 if you're admitted to the hospital plan, and $1,000 for your outpatient services, which it works the same way. The outpatient services will cover all of your radiology diagnostic testing. That would be MRI, CT scans, PET scans, also oncologists, chemotherapists. It also will include your emergency rooms, urgent cares, and outpatient procedures as far as your additional $1,000 ambulance coverage. So the gaps are identical with the same benefit, except the amounts change. On this gap is a $2,000 for inpatient, $1,000 for outpatient. And this is the gap you can purchase for the PPO plan on page 9 and for your mid HMO plan on page 8. We'll be moving forward to register on myhumana.com. I highly recommend to go on to humana.com, register. It'll ask you for your date of birth, Social Security. Once you register, you'll be able to see your ID cards and print them. You will see your claims history. You will see how much of your deductible you've met, your prescription calculator, which is a really excellent tool to figure out where to get the best savings for your prescription. So it has a lot of tools that help you in knowing how to use your insurance. And the mobile app, again, that I highly recommend for you to download onto your smartphones. You can basically see everything pertaining to your specific plans. Your next plan on page 13 is your dental plans. Your dental plan did change from last year. Last year you guys were with Humana. This year you're going with MetLife. So again, if you select the dental plan, you will receive a new ID card through MetLife. And again, you have two dental plans to choose from. The HMO plan, keep in mind, it is a more limited network. On the HMO plan, you will have a dentist selected that you can select, or that the system will select for you, that's the closest to your home. You do need to go see that dentist. If you want to change it, by all means, you can change it as many times as you want. As long as you change it by the 1st of the month, the new dentist will be effective the 1st of the following month. But you do, on the HMO plan, need to go to that dentist that you're assigned to. The office visit, there is no deductible. There's a $5 office visit. The deductibles are waived for your preventive visits. On the dental plans, your preventive visits are every 6 months. So that every 6 months you can go for your regular checkup, your regular cleanings, and your x-rays, and you pay nothing. They are covered at 100%. On the HMO plan, you're going to notice that everything is based on co-payments. The co-payments are based on negotiated prices that the dentists have with MetLife. So what I highly recommend on any dental plan, before getting any procedures done, make sure that the dentist submits that to MetLife so that you can see what your co-payments are for the procedures code that he feels that you need services rendered for, so that you'll know what the cost is to you prior to receiving the service. That will include your basic services, your major services, and your periodontic services. Your HMO plan does not have a maximum, so your benefits never end. You will be paying the contracted prices for your services. So for example, if you need a crown average contract is about $430 for a crown. We all know that a crown is over $1,000. So you would pay the $400, the $230, whatever the negotiated price is for the procedure is what you pay within the HMO. And again, it is unlimited. Orthodontic is covered on the HMO for adult and children, okay? And on the dental is up to the age 26, all right? With your PPO plan, this gives you a bigger network. You have in-network and out-of-network. Again, I highly recommend to always stay in-network. Out-of-network means the dentist does not have a contract with MetLife. So that means to you that they can charge you whatever they want. So you will be getting less benefit out of your dental plan. The question to ask with a PPO plan to the dentist is not, do you take my MetLife PPO? Because they will always probably say yes, because they know that there's out-of-network benefits, but you're going to be leaving benefits on the table. So the question to ask is, are you contracted? Are you in network? The name of the network is a DPPO provider network. A PDP is the name of the network, if they happen to ask you. So on this PPO plan, I'm going to go over the in-network benefits. Although they look the same, understand that it is not the same because it is not contracted prices, the billed amount. So on both, it's a $50 annual deductible, $150 maximum for the family. Deductible is waived for your preventive. Remember, your preventives are every 6 months and are covered at 100%. Your basic services are covered at 100% in-network, 80% out of network. Keep in mind that 80% is not the negotiated price that you're paying in network. It will be whatever price the dentist charges. So you will be losing benefit amounts there. Major services, 60% in network, 50% out of network. Your periodontic and endodontic are covered under basic. That means they're covered at 100% in network, 80% out of network. On the PPO plan, you do have a maximum annual benefit. On this plan is a maximum annual benefit of $2,500. Your in-network is reimbursed at fee level, where when you go out of network, it's based on usual and customary. Orthodontic is covered at 50% for children only up to the age of 19. So on the PPO, you do not have adult coverage for orthodontics. The maximum benefit for orthodontics is $1,000, and the age for the dependent is 26. Your next set of benefit is your vision. Your vision remained the same. It is still with Humana. This is for a one-time annual visit for a checkup of your eyes for glasses or contacts. If you have a disease of the eyes, it is covered through your medical plan under an ophthalmologist. So this is only for contacts or glasses. For your eye exam, again, you can go every 12 months. You pay $10 for that checkup. For materials, that would be your basic plain vanilla lens is $15. Any other type of additional things you'd like to add onto the lens, there will be additional co-payments. You can get your lenses every 12 months as well. As far as your frames, the benefit will give you up to $130 towards the purchase of your frame, and an additional 20% discount off of the balance if you go over the $130. You can select contacts if you wish to do so. Please understand it's either contacts or lenses. You cannot get both during the same plan year. And they'll give you up to $130 towards the purchase of your contacts. And again, every 12 months. And your dependents are eligible till the age of 26. You also have voluntary life and accidental death and disbursement that you can purchase. You can buy up to $10,000 increments, not to exceed 5 times your annual salary. Please understand that there is guaranteed issues amount. If you're new, if you want to increase, there will be some medical underwriting if you go over the maximum amount. You can also purchase insurance for your spouse and for your dependent children. There's also the colonial products that you can purchase. These products basically pay you. They do not pay the provider. So if you have an accident, let's say, and you got a burn, you went to the urgent care, they'll pay you for that burn, or for a cut, or for a broken bone. Whatever the accident is, there'll be an amount for that injury, and they will pay you for that injury. There's a critical illness plan as well, and there's a medical bridge plan as well as a disability insurance. When you sit down with Colonial, they will be more than happy to go over the benefits and let you know what the pricing is. Since the pricing is individual, will be based on your own information and age. These policies are yours, and the day you're no longer affiliated with Adonel, you basically can keep these benefits and the rate will not change. You also have free grieving through MetLife counseling, totally free, totally confidential. Any type of assistance due to a divorce, a loss of job, problems with teenagers, any type of professional counseling, the information is listed there for you, and it is totally free and confidential. There's the information on page 18 on Florida Kid Care. Should you have a child that you're interested in trying to insure through one of these programs, we've provided that information for you on this page. Medicare Part D is just letting you know that all of the benefits being offered to you through Adonel meet and exceed the Medicare Part D rules and regulations. The next couple of pages, 20 and 21, are basically laws and regulations that Adonel would like you to become familiar with. You can read these at your leisure. Next page, 22, this is an important page. This page is giving you some tips on where to purchase your prescriptions to help you keep the costs down. A lot of the times when we receive a prescription, the first thing we do is we run to the pharmacy with prescription in hand and an insurance ID card on the other. Where a lot of the times, as you notice when we went over your benefits, those prescription co-payments are a lot higher than if you were to go directly through a generic plan through Publix, CVS, Target, Walmart, Kmart. These are all generic prescription programs. You do not need to use your insurance ID card for these plans. And you'll note that a lot of the times you're paying a lot less for the prescription than if you were fulfilling the prescription through the insurance plan. There's also the Good RX benefit for your brand name medications. Should you receive a prescription for brand name, go into the GoodRx website. We've listed that for you there. Plug in the name of the prescription. A whole bunch of pharmacies will pop out, and you'll see the huge discounts that you get. So again, with these two types of options, you do not need to use your insurance ID card. When you receive a prescription from your doctor, make sure to discuss with your doctor if it is a generic, and if it's not a generic and the medication comes in a generic, can he write you the prescription for a generic? Because you will find that generic medication are always a lot less costly than your brand name medications. Next, page 23, a lot of the information that I've already discussed with you about stretching your dollar, the difference between your doctor's office, your hospital, and your pharmacy, which a lot of those points I've already addressed throughout the presentation. We also want to educate you on your different options when you're sick. Where do you go? Where's the least costly? Well, always keep in mind that any hospital-affiliated facility is always going to be the most costly to you. So we've listed for your help just a couple of situations that you might need to either get services rendered for, and we'll let you know there's telemedicine available to you, your primary care physicians, your urgent care, your freestanding ERs and your hospital ERs, and of course your urgent care centers. Which one you should go to depending on the type of situation that you might be having. And again, some education regarding your preventive visits, which I've discussed already, for adults, women, children, and Medicare eligibles. And last but not least, financial wellness. It is very important, so we give you some tips on this page on how to reduce your debt, how to build savings, and how to track your spending. And wellness, of course, when you go for that annual preventive visit, please keep in mind we highly stress that you take advantage of that annual free visit. Prevention is a key to a happier, healthier life. Make sure to discuss with your doctor and know what your numbers are. Your blood pressure, your cholesterol, your blood sugar, your body mass index. Since this might avoid you having to take medications if you're borderline cholesterol, let's say, or borderline diabetic. Maybe a discussion with your doctor during that preventive visit will prevent you from having to take those medications. That concludes your benefit information and your benefit structures. Again, feel free to call us if you have any questions, any concerns. Keep in mind that under the directory, you have a go-to person by the name of Robin Konikoff that you can always reach out to. Thank you so much, and welcome to Adonel's Open Enrollment.